Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Allison Cole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same. Hello and welcome everyone to a new episode of the Sleep is My Waking Passion podcast. Before we get into it with this guest, today the topic is going to be living with narcolepsy. Okay, so pause before you're like, I don't know what narcolepsy is, but I don't think that impacts my life. I want you to pause there because we know that narcolepsy is considered to be a rare disease. A lot of people think of Mr. Bean, who's falling asleep everywhere in weird places, as being the kind of example. That is not the reality of people living with narcolepsy. And I also want to hit pause here because there's probably somebody that you know that's a little too tired and you don't have an explanation for it. This might explain it. We actually think that it's less rare than it's made out to be. It's just going under recognized. And Dr. Lindsay McCullough is a board-certified sleep medicine physician who is also a patient. So if there are medical students in your family or who are listening to this, you really got to hear her story. Because we're not taught to care about ourselves or to focus on ourselves. We're taught to focus on the health of other people, but you cannot help others if your cup runneth empty. And Lindsay's going to share what she's learned through her journey. So without further ado, Dr. Lindsay McCullough, MD, is an assistant professor of sleep medicine and associate program director of sleep medicine, their fellowship program at Rush University Medical Center in Chicago. And I know her through the American Academy of Sleep Medicine. We're both on the advocacy committee. And my mind was blown when I heard her story. And I was like, please, can you come and hang out with me and share your story? So welcome, Lindsay.
Thank you so much for having me, Allison. It's such a joy to be able to speak about narcolepsy, and I just appreciate all the advocacy and awareness that you do with your podcast and all your work. So thank you so much.
Well, I appreciate you joining me on this journey. Just to level set, one of the things we talked about was what the optimal time was for you to do the podcast. Can you share a little bit about, how you determine when you're going to do certain activities so that you can be your best or be on?
Yeah, so I appreciate you accommodating me, and it's taken me a long time to get to a point where I will ask for specific things. And I notice my brain works best somewhere between 8:30 and 9 till about 2:30 or 3. And so my high energy, really need to think things, I try to fit in that time, and the earlier the better.
You have type 2 narcolepsy. Yes, professor. Please tell us about type 2 narcolepsy. What the heck is type 2 narcolepsy?
So type 2 narcolepsy, we actually understand a lot less about than type 1 narcolepsy. Type 2 narcolepsy and idiopathic hypersomnia, another hypersomnia disorder, seem to have a decent amount of overlap. Essentially, there are some significant key symptoms for narcolepsy. There's excessive daytime sleepiness. Anyone with the hypersomnia disorder will have that. And then you may have a sprinkling of other symptoms like disruptive dreams, or maybe even hearing or seeing things that aren't there as you're falling asleep or waking up. I know I experienced some of those hallucinations and would have to call my neighbor to come over in residency to make sure no one was in the house. That was interesting. There's sleep paralysis, which can happen, in the general population as well, and for other sleep disorders, but where you wake up and you feel like you can't move your body, whereas you're falling asleep, and it can be terrifying. And you're kind of in between the sleep and wake state. In type 1 narcolepsy, which is not what I experienced, but with strong emotions, you may lose muscle tone, usually positive emotions for a couple minutes. You're still awake, but that can be a confusing symptom for many clinicians and patients alike. Another symptom that is coming out more in the forefront more recently, and they talked a lot about at the sleep meeting, is brain fog, which is something that I experienced and I do experience as someone with narcolepsy. We all thought about sleepiness, but this brain fog where maybe you're having these word finding difficulties or you're just having trouble processing things is another big symptom. And it's a chronic neurological disorder, meaning there's not a cure for it yet. There's lots of treatments and something happening in the brain.
I love that. I'm going to add one more symptom that sometimes we don't think about, which is disrupted nighttime sleep.
Yes. Thank you for bringing that up.
Yeah. So sometimes people may come across more like, well, their sleep is really not that great. They seem to be waking up a lot, or they're just aware that their sleep is not great. And that was something that was a rude awakening for me to even think about for my patients. Like, shoot, I've had patients that are sleepy. Like, did I miss this window of opportunity? You think back and you go, should I have done that case differently or behave differently? So every discussion that we have not only helps teach the general public, but also gets sleep doctors more comfortable with stuff that's even kind of challenging for us to make that diagnosis. Speaking of these specific symptoms, now you mentioned the hallucinations and you mentioned the brain fog. When did all of this start happening? How did you even get to the point of realizing that there was a true sleep disorder that you were essentially living with?
Yes, it was certainly a surprise when I got the diagnosis. Middle school and high school, I was always the one that could sleep really, really well anywhere, anytime. And our band trips, I remember we drove up to Washington, D.C., and I was able to sleep on and off most of that trip when everybody was awake. And I had these really, really vivid dreams that most of the time people don't want to hear about your dreams, but people wanted to hear about mine because they were just so wild. So it started in my early teens, but I was still able to function, push through, didn't really think there was ever an issue. In college, same thing, was able to push through. But would often fall asleep in the middle of the afternoon when we're watching a movie, different things. When I got to medical school and started doing my rotations, my sleep was a little more restricted. And at the same time, I got a upper respiratory infection when I was on my pediatrics rotation. And
sounds about right.
Yeah,
those little fomites called children, right? There's just nonstop boogers.
Yeah. And after that, my symptoms got a lot worse. I was coming home and taking 2-3 hour naps and then eating dinner, trying to study a little bit, sleeping the whole night through, and just having a lot of time retaining information, staying awake during my rotations. I was just trying to push through. I figured it was just, this is medical school, this is hard. And I got to my family medicine residency, which had more reasonable hours. And my preceptor pulled me aside and asked me if I was really serious about medicine, because it didn't seem like I was studying. It didn't seem like I was putting forth as much of an effort, which was devastating to me because I cared so much. But it was also a wake-up call that, okay, this is not me. There might be something going on medically. So I went through a similar, I've heard other patients talk about this, is it depression, right? A lot of medical students are depressed. So let's treat that and see. And, it is depressing when you feel like you're not doing well. And there's a lot of overlap. But I got to the point where I came back to my doctor and I said, I don't really feel depressed. I just feel sleepy and I'm kind of desperate. I'm not doing well on my exams. Can I just try a stimulant? And my doctor said, yeah, we can try this. But if you continue to need it or it helps, we have you see psychiatry or sleep. And I was like, sleep medicine? That's a discipline? I had zero clue.
I know. Isn't that nuts? I'm like, what the heck is sleep medicine? I didn't even know that was a thing.
Exactly. No idea. Still, narcolepsy is not on my radar at all. I remember on my preclinical years in medical school that I watched a video of this cute little dachshund with narcolepsy and Rusty. He's so sweet. And he just kind of is trotting around and then kind of falls over. That's all I learned about narcolepsy. And narcolepsy, like you mentioned, Mr. Bean, I just assumed people just fall asleep at the drop of a hat. So still was not even a thought for me. And I made it to the sleep center, Dr. Rich Berry, who I love dearly. He's such a sweet, wonderful physician. But he said, hey, I don't really think you have sleep apnea, but let's do this testing for hypersomnia disorders. And then in the fall of my 4th year of medical school, I got my diagnosis. He called me.
You were diagnosed by the Dr. Richard Berry.
Yes.
Guys, this guy's like a friggin' icon. Okay. This is nuts.
A legend. And
wow.
So down to earth and wonderful and incredible. So I owe so much to him for helping me through that time and my time through residency too. He's just an incredible person.
I want to pause for a second and just, if anybody is listening again, medical students, there's so much stuff on Google there's AI. There's even questions amongst us as physicians like, dude, what are we spending all this time in school, knowledge, like feeling sometimes even replaceable in our current healthcare model? I think it just needs to be said, if you think about the path to where we took in the United States, you're looking at 4 years of an undergrad, and then you have 4 years of medical school. Residency is just another kind of leap forward. And then there's fellowship training, whatever that may be, if that's what you choose to do. Those steps, you're looking like at 8 years just to get to the point of residency, and to feel as though you go through all of those steps and you're not good at medicine, to have your residency instructor basically kind of flag that, you know, like, what's your deal? Are you serious? And really, you're just trying to manage with a sleep disorder. That hits home so much. So even if you don't even know what the heck is going on, the fact that you spoke up, that you mentioned the word sleepy, by the way, how we talk to people, especially physicians, when we get so little training during our medical school and even our residency training about sleep. It is the most de-emphasized thing we can do for ourselves even. None of that stuff is emphasized at all. It's like, no. It's the culture of like, work harder, sleep less. And you mentioned it. I didn't have the opportunity to get as much rest. That's like, you know, a badge of honor almost. I mean, think about like, thank God you weren't trying to go into surgery. Oy vey. I can say there, it'd be up at like 5 a.m. and you work for 18 hours, and you better not be tired by the end of that. I mean, that would have been very, very challenging. So I wanted to pause there because that's such a huge point. So once you got your diagnosis, what happened from there?
So it was a lot of emotions, feeling relief that there's an answer to why I'm feeling this way, but also some devastation. This is not getting better. This is a chronic condition that I'm going to need to manage. And my thoughts about narcolepsy again that was not on my radar. It's people just falling asleep constantly throughout the day. Am I going to be able to be a clinician? You know, I'm applying for residency now. I have medical school loans. How am I going to do this? So there was a lot of fear and anxiety and shame. I mean, people laugh at narcolepsy. People don't understand narcolepsy. And so there was a lot that I had to take into account when applying for residency and kind of planning my life. And I really just kept it to myself and my family. I didn't really tell people because I was ashamed to have this diagnosis, and I didn't want this mark on me when I was applying for residency and applying and trying to be the best doctor I could be. So I kept trying to go along as a normal person while secretly battling this narcolepsy and getting some medications for it.
That, I can't even imagine how that feels, because I remember battling depression during that time, and trying to resolve that issue. You know, insomnia, which is a lot easier to hide because you just pound coffee, the black yucky stuff that's left over after a day of surgery, sometimes on your rotations, like whatever I could get my hands on, pounding that. I never really wanted to talk about any of that, especially not mental health. Yeah. And here you are with a true neurologic condition. Obviously that shaped you tremendously, and keeping that a secret, I can only imagine, was such a huge burden on you. What advice would you give other people in your scenario, medical students looking forward to the future yet living with a chronic condition that is irreversible like narcolepsy? Are there things that you did that you would do differently? Even hiding it, would you have been more open about it? Like, what do you want people to really know about that experience and honestly what you learned from it?
So I think there's a lot more acceptance and ability to get accommodations now. It's a personal decision how much you want to share your diagnosis and how open you would be with it. If I had to go back, I would have disclosed it at least to the HR department where I matched my residency. I decided to stay at my home program because I knew people and had established, not only did I know people, I knew where the bathrooms were. I knew some of the systems. So that was helpful and wasn't entering in a whole new place. But there are legal accommodations that can be made for you. that I wish I would have spoken up about, and they are kept confidential. I was sleeping in my car, taking naps and different, that was pretty unsafe. Eventually, I told a mentor that I trusted and had a separate call room and had some accommodations in place. So I wish I would have been more open about that. There's also a lot more resources for connection and social support now than there were when I was in residency. There was the Narcolepsy Network, which Dr. Berry did give me some information on, and I felt so ashamed. I didn't even want to engage in that. And now there's, not only is there Narcolepsy Network, there's Hypersomnia Foundation and Project Sleep. And
she's an ambassador for Project Sleep. Plug for Project Sleep. Amazing.
Yes, World Narcolepsy Day, September 22nd, coming up. And Wake Up Narcolepsy, PWN for PWN. There's these connecting organizations that have helpful information for you, support groups, podcasts, different toolkits, different ways to empower yourself and to help see yourself as, like, in addition, this diagnosis can build your character and be an asset for you. So anyways, when I finally met somebody with narcolepsy, I actually met Julie Flygar, who is the founder of Project Sleep and wrote Wide Awake and Dreaming. I had read her book. That was the only quote unquote person I knew with narcolepsy because I'd read her book. And I met her at the end of my sleep fellowship presenting at the sleep meeting. And I just burst into tears because it was just so nice to know somebody who knew what it was like and what we'd gone through, and I've since been connected to so many people. So get your accommodations and get connected because you're not alone, and knowing that and feeling that is powerful.
Do you think it shaped how you even counsel the trainees that are under your wing in terms of like what you kind of highlight or point out to them?
In terms of, you mean sleep medicine fellows or even medical students and people?
Anybody who comes into your orbit, how living with narcolepsy shaped that relationship for you?
I'm pretty open about my diagnosis with my patients and also with people who I mentor when it comes up, to break down that barrier, to help people feel understood, because everybody's going through different things at different times. And I tell people, if you're feeling tired or sleepy, that's not normal. There might be a reason for it. So in terms of the people in my orbit that I'm training, look at your own sleep and consider something else could be going on if you're not feeling your best self. I just think taking care of yourself. I have a chair in my office that opens up into a bed so I can take a nap. And so I'll say to my fellows, like, hey, I'm going to take a 20-minute nap. Can we regroup after that? And just normalizing some of the things that I have to do for this so that people will be more open to taking care of themselves too.
I love that. I bring it up because you are shaping the brains of these young folks. And I almost want to go back to that family practice residency person and like shake them and be like, you are seeing these people in your office. Yeah. You are just not recognizing it. So common things being common. One of the cool things about medical schools, we talk about Occam's razor. Can you put all the symptoms into one specific diagnosis? And we also talk about zebras, right? Common things being common, but zebras aren't that common. So look for the zebras, because that's one of the, I think, the real strengths of going through all the training that we do is that we can make connections that sometimes get lost if you're just focusing on what the majority of folks have. Thank you so much, Lindsay, for sharing this story. You are just such a powerful human. I'm so excited to work with you and hang out with you and kind of advocate for sleep health on Capitol Hill, even if it feels sometimes like it falls on deaf ears. Hooray.
No, me too. Like I mentioned, I didn't even know sleep was a specialty, and just learning about the power of sleep and how it can enhance the health just across the board for anyone has made me a passionate advocate and led me into sleep medicine too. So I just thank you for having me. If you don't mind, I just want to close. I don't know if there's any physicians or medical students or anybody coming on here, but I have these 4 pillars of therapy that I think are really important if you have a hypersomnia disorder, because a lot of people focus on treatment as the medications. And there's been an explosion in medications for the hypersomnia disorders. There's more in the pipeline that's so exciting. But I find that as just one piece of the puzzle. I think the behavioral and lifestyle modifications that you do are really important. I wasn't able to get enough sleep, and somebody with narcolepsy or hypersomnia disorder, if you're sleep deprived, you're going to feel a lot more than even someone who doesn't have that condition. We mentioned the social support, mental health. There's the sleep psychologist can also be really helpful in your journey.
Do you have a specific sleep psychologist when you say that? Is this distinctive from the cognitive behavioral therapy piece that we often use for insomnia when you say sleep psychologist?
So there is a protocol for cognitive behavioral therapy for hypersomnia. There's Dr. Jen Munt does a lot of this, and she'll also do CBT for nightmares, which is common for patients with hypersomnia disorders. Some of it is also based on some acceptance and commitment therapy. So it can be really hard to find a sleep psychologist. So if you are unable to, but you have a strong, psychologist that can work through this with you, I think that's really helpful as part of the mental health piece, in addition to that social support. And then the fourth is just the accommodations that we talked about can be really helpful. I've adjusted my work schedule. Sleep medicine I love it regardless for so many different reasons, but it also does not have a lot of emergencies or calls, so I'm able to get my sleep, which is a nice thing. And when you come in, if you're a patient coming to talk to your sleep doctor, I think it's helpful. Allison, you mentioned saying sleepy, saying these terms that are really important for doctors to hear, but I think also bringing real life examples is really important and can help doctors understand the impact and help you understand the impact of your symptoms too. So for example, like you couldn't make it to work on time a couple times last week because you couldn't wake up or something like that.
Really concrete.
More. Yeah.
So having a diary or a journal of your symptoms too, so that you can kind of remember them, because sometimes you wait months to go see the doctor and then you're like, all of my examples just floated out of my brain. So have them ready to go so you don't have to think about them. Yeah.
Exactly. Yeah. And the Hypersomnia Foundation has a diary that you can record, and I'm just thinking about, positive things about your day, but also like what things did your sleep disorder make difficult so that you can address those and target those at your appointment.
Now, you mentioned behavioral modifications, things that people can do besides take medication to treat narcolepsy. Can you delve a bit into some, speaking of concrete examples, some ways that people can put the modifications into actual action steps?
Yes. So having healthy sleep hygiene, trying to not only allow enough time to sleep, but having regular and consistent sleep and wake up times, and getting bright light in the morning can be helpful. For some people with narcolepsy, having a 15 to 20 minute nap a few times a day can be really refreshing. For others, that's not as helpful, but finding out if that works for you. A lot of people find that if they're having smaller, more high protein meals throughout the day, that can be helpful. A high carb meal can cause you to crash, or having a larger meal can cause you to crash. Getting exercise. People with narcolepsy also have a higher incidence of cardiovascular disease, so exercise is important anyway, but trying to get a half hour a day, getting your heart rate up can be helpful for the energy levels as well.
So I would love what you're saying here, because what I'm hearing is a connection to what the heck people without narcolepsy need to do too. Right? We need to have good sleep hygiene, turn off those electronics, allow your brain time to decompress. I love the exercise piece. One of the other things that narcolepsy is also associated with is a much higher body mass index, parenthesis, obesity. We get heavier if you're not moving around because you're so sleepy and you're sleeping all the time. It really can muck up your metabolism. Thank you so much for these tips. These are huge, and they're going to make great social media posts. So I'm going to make sure we do a few of those. That's going to be fun.
Awesome. Thank you so much for having me, and thanks for just spreading awareness. And hopefully people listening to this know that you can do it.
Yes, you can.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit askthesleepmd.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.